Annoying redness and blotches on the face are common complaints, but how do you know when your irritation is something more than just dry skin or acne? If you are experiencing painful redness, you may be one of the estimated 14 million Americans suffering from rosacea. And here to tell us more about the condition and how it is treated is dermatologist Dr. Doris Day. Dr. Day, great to have you back on the show.
Thanks for having me.
So rosacea is something that I guess affects a lot of people. Can you tell us what it is exactly?
Rosacea is a very common condition, and we think it affects at least 14 million Americans. And the problem is that most people don't recognize that they have it until they go see their doctor. And so they're treating it as all sorts of other conditions, and those treatments can actually make the rosacea worse.
Is that because the symptoms are so vague?
Well, the symptoms are a little bit unclear sometimes. They can mimic other things. We actually call it the great disguiser. You can see several different things. Sometimes you can have just simple redness and broken blood vessels. That's one type. Men tend to get a prominent nose, something we call rhinophyma, a bumpy, bulbous nose. Rosacea can also affect the eyes, and that's called ocular rosacea. You have a gritty feeling in the eyes or lots of styes. But it can also look a little bit like acne, that you can have pimples and bumps in the skin as well. But it is different than adult acne because that's more hormonal, it's more on the lower face, and with acne you do have more blackheads and whiteheads, and that's not seen in rosacea. Rosacea does affect the cheeks, the chin, the nose, the forehead, and adult acne is really more along the lower face.
But rosacea does or can develop as we get older, is that right?
Rosacea is more of an adult pattern, and that's why some people do call it adult acne. So you start to see it in the late 20s, 30s, 40s, and for most women who get it, it does get a little bit better after menopause. So that's something to look forward to with menopause.
That's right.
The one thing. Exactly.
Is it hereditary? I mean, how do we get it?
We're not really sure. There may be a hereditary component to it. And we really don't know the main underlying cause. Like with acne too, we don't know the main underlying cause, but we do know that with rosacea, there's one good thing about it is that there are triggers, so you have some control. And the triggers are pretty clear. So we know alcohol is the biggest trigger for rosacea. Stress is a very big trigger, and obviously you can't not stress at all because, you know, in life, if you're living it properly, there are going to be stressors.
Of course.
But you can manage your stress better, and if your rosacea is flaring quite often, you have to think about what your triggers are, and if stress is one of them, you have to look for ways to manage that stress.
Absolutely.
Extremes in temperature can also be a very big trigger. So in the winter, when it's cold and windy outside and you have that blast of dry, hot air when you go in, that can be a trigger. You also have to think about foods, and people tend to have their own personal triggers. Spicy foods tends to be a very big trigger for most people, but you have to think condiments and small things. It could be vinegar, soy sauce, wasabi, little things, not necessarily the main dish itself. And you have to